Hello everyone, we are from Group 3 and today we are going to talk about obsessive compulsive disorder, which is also known as OCD. So, what is OCD? OCD is an anxiety disorder where people have recurring unwanted thoughts, ideas, or sensations that make them feel driven to do something repetitively. The word OCD consists of obsessions and compulsions. Obsession is the thought, image, or impulse that occur repeatedly and feel out of the person's control. Individuals with OCD do not want to have these thoughts and find them rather disturbing. As for compulsions, repetitive behaviors are thoughts that a person uses with the intention of neutralizing or making their obsessions go away. The behavior are aimed at preventing or reducing distress or a fear situation. Although the compulsion may bring some relief to the worry, the obsession returns and the cycle repeats over and over again.
Causes of OCD, obsessive compulsive disorder. The disorder is equally common among adult men and women. OCD might be triggered by a combination of genetic, neurological, behavioral, cognitive, and environmental factors. Genetic causes of OCD. OCD runs in families and can be considered a familial disorder. The disease may span generations, with close relatives of people with OCD significantly more likely to develop OCD themselves. Twin studies of adults suggest that obsessive-compulsive symptoms are moderately heritable, with genetic factors contributing 27 to 47% of variance in scores on measures of obsessive-compulsive symptoms. However, no single gene has been identified as the cause of OCD. Autoimmune causes of OCD. Some rapid onset cases of obsessive-compulsive disorder in children might be a consequence of group A streptococcal infections, which cause inflammation and dysfunction in basal ganglia. These cases are grouped together and referred to as pediatric autoimmune neuropsychiatric disorders associated with streptococcal infections, PANDAS. In recent years, however, other pathogens such as the bacteria responsible for Lyme disease and H1N1, the flu virus, have also been associated with rapid onset of OCD in children. As such, clinicians have altered the acronym to PANS, Pediatric Acute Onset Neuropsychiatric Syndrome. Behavioral causes of OCD. The behavioral theory suggests that people with OCD associate certain objects or situations with fear. They learn to avoid those things or learn to perform rituals in order to help reduce the fear. This fear and avoidance or ritual cycle may begin during a period of intense stress, such as when starting a new job or when a relationship comes to an end. Once the connection between the object and the feeling of fear becomes established, people with OCD begin to avoid that object and the fear it generates, rather than confronting or tolerating the fear. Cognitive causes of OCD. The behavioral theory outlined above focuses on how people with OCD make an association between an object and fear, whereas the cognitive theory focuses on how people with OCD misinterpret their thoughts. Most people have unwelcome or intrusive thoughts at some time or other, but for those with OCD, the importance of those thoughts are exaggerated. For example, a person who is caring for an infant and who is under intense pressure may have an intrusive thought of harming the infant. Whether that thought is of intentional or unintentional harm, most people can shrug off and disregard the thought. but a person suffering from OCD may exaggerate the importance of the thought and respond as though it signifies a threat. As long as the sufferer interprets these intrusive thoughts as cataclysmic and true, they will continue the avoidance and ritual behaviors. Neurological causes of OCD. Brain scans have shown abnormal activity in patients with OCD. Brain imaging techniques have allowed researchers to study the activity of specific areas of the brain, leading to discovery that some parts of the brain are different in OCD sufferers compared with non-sufferers. Despite this revelation, it is not known exactly how these differences relate to the development of OCD. Imbalances in serotonin or glutamate may play a part in OCD. Environmental causes of OCD. Traumatic brain injury (TBI) in adolescents and children has also been associated with an increased risk of onset of obsessive compulsions. Overall, studies indicate that patients with OCD frequently report stressful and traumatic life events before the illness begins.
Next, knowing the causes of OCD, it is significant to determine the symptoms of having OCD in order to apply or use treatments correctly. Symptoms of OCD include obsessive thoughts and compulsive behaviors. Obsessive thoughts, repeated unwanted ideas in which they will keep repeating the same idea because they think it is important for others to understand and accept his ideas. Fear of contamination. They are afraid of getting things contaminated with germs or dirt, in which they will clean their belongings constantly. Excessive focus on something. They focus on certain thing too much that eventually develop fears in them. Persistent sexual thoughts. Thoughts of hurting others or might be harmed by others. Order and symmetry, where they will try their best to ensure that everything is lined up just right or perfectly. Compulsive behaviors. Constant checking. They will do excessive double checking on things such as locks, appliances, and switches, or repeatedly checking in on their loved ones to make sure that they are all safe all the time. Constant counting. They will count, tap, or repeat certain words or doing other senseless things in order to reduce anxiety in them. Repeated cleaning of one or more items, where they will spend a lot of time washing or cleaning. Wash hands repeatedly. The need of washing hands after each time of touching any foreign items that they think everything consists of germs and dirt, which makes them uncomfortable. Arranging items to face a certain way. They need everything to be arranged in the same way and order to satisfy their needs. Besides, symptoms of OCD also can be seen emotionally, where people who are suffering from OCD will constantly feel depressed, worried excessively, extreme tension, and always feel that nothing is ever right for them.
Ways to manage OCD. The first part is about the behavioral. First point, don't avoid your fears. Smart to avoid the situation that trigger your obsessive thoughts, but the more you avoid them, the scarier they feel. Try to resist or delay the urge to complete your relieving-seeking compulsive rituals. Each time you expose yourself to your trigger, your anxiety should lessen and you will start to realize that you have more control than you think. The next point is refocus your attention. Try shifting your attention to something else. At the end of the delaying period, reassess the urge. In many cases, the urge will no longer be quite as intense. Ways to manage OCD physically. First point, exercise regularly. Exercise is a natural and effective anti-anxiety treatment that helps to control OCD symptoms by refocusing your mind when obsessive thoughts and compulsion arise. The next point, practice relaxation technique. While stress doesn't cause OCD, it can trigger symptoms or make them worse. Mindful medications, yoga, deep breathing, and other relaxation techniques can help lower your overall stress and tension levels and help you manage your urge. Ways to manage OCD physically. Avoid alcohol and nicotine. Alcohol temporarily reduces anxiety and worry, but it actually causes anxiety symptoms as it wears off. Similarly, while it may seem that cigarettes are calming, nicotine is actually a powerful stimulant. Get enough sleep. Not only can anxieties and worries cause insomnia, but a lack of sleep can also exacerbate anxious thoughts and feelings. Ways to manage OCD: social support. First point, join an OCD support group. You are not alone in struggle with OCD, and participating in a support group can be an effective reminder of that. OCD support groups enable you to both share your own experience and learn from others who are facing the same problems. The next point, stay connected to families and friends. Obsessions and compulsions can consume your life to the point of social isolation. It's important to invest in relating to family and friends. Tips for helping a friend or family's member with OCD. Here have a do and don'ts. Do. Be as kind and patient as possible. Find the humor. Laughing together over the funny side can help your loved one become more detached from the disorder. Keep communications positive and clear. Don't. Do not play along with your loved one's OCD rituals. Don't let OCD take over family life. Don't scold someone with OCD or tell them to stop performing rituals.
What will happen if you don't manage OCD? Obsession can interfere with your thinking process. Left untreated, these recurring thoughts and urge can decrease your ability to concentrate and interfere with short-term memory. Compulsion consume valuable time and drain your energy, both physically and mentally. They force you to focus on details and insignificant, even non-existent issues rather than what's important. Without treatment, however, symptoms are likely to get worse and take up more and more time and energy, severely limiting a person's time and capacity to study, work, and socialize with friends and family. Students with untreated OCD risk such as academic failure, social isolation, physical and emotional exhaustion, developing secondary disorders such as depression or substance abuse. Statistics of OCD. OCD affect 1 to 2% of population in Malaysia. It cut across all ethnic groups and affect both male and females. The onset of OCD is earlier in male, between 6 to 15 years of age, while the disorder affects female in the age of range of 20 to 29. The prevalence of mental health problems among adults increased from 10.7 in 1996 to 11.2% in 2006 to 29.2% in 2015. Estimate 285,000 of Malaysians has OCD.
Conclusion. Obsessive-compulsive disorder, OCD, is getting more common nowadays. It is vital to tackle the problem with suitable ways to prevent the bad outcomes.
That is all from us, thank you.